Hey community, we're back and I'm Brandy B, the Community NP.
And I'm Brandy G, the Community NP.
And together we are
B&B The Community NPs.
Today's discussion is
Syphilis.
Syphilis, yes.
So I think this is our last STI, STD.
Yes,
I think it is. I think it is.
I think
we
so
touched
too.
on everything.
Yeah.
If not, you may have another video. But I think it is.
Right, yeah, I think this is the last one.
Yes.
Which has been long. There's been some breaks, but there's still a lot of topics on STDs, STIs.
Yeah.
But okay.
So talk about syphilis.
Definition.
All right. So syphilis is a sexually transmitted infection or disease. Mm-hmm. It's caused by the bacterium Treponema pallidum.
Yeah.
That's the way I'm going to say it.
Yeah.
Okay. So syphilis can be serious. Like it can cause health problems like for a long period of time if it goes untreated. Mm-hmm. So when a person contracts syphilis, it may take a while before they have symptoms. It could be anywhere from like 21 days, but it can range from 10 to 90 days. So that's a long period of time that you done contracted an STI and you may not know that you had it.
Because can they still spread it during from day 1 to 21?
They can. So it's usually transmitted from person to person. Mm-hmm. You can do direct contact if you have like a little called a syphilic sore. Mm-hmm. It's called a, how you say it? Chancre? Chancre. Okay. Syphilis. So, called a chancre. So usually you may have the little sort of chancre. And if that chancre gets in contact with like external genital areas, the vagina, the anus, the rectum, or even the mouth. Yeah. That's how you transmit syphilis from one person to the other person.
Okay. You know, the chancre, I always pronounced it canker.
Me too.
I wonder, is it?
But like you get shanker. Don't y'all shank nobody.
Yeah.
But shanker.
Yeah. So the transmission of syphilis can occur like through vaginal, anal, or oral sex. And also it can be transmitted from a pregnant mother to the child.
Yes. So I can see why it's important
to get tested.
Get tested for syphilis, especially during pregnancy. They test you for all the STIs, I see why it's important. Mm-hmm. So some of the risk factors. So B, tell us about some of the risk factors.
So any person with signs or symptoms suggestive of syphilis should get tested. Anyone who is having oral, anal, or vaginal, or anyone with an oral, anal, or vaginal sex partner who has been recently diagnosed should get tested for syphilis as well. Okay. So, and basically anyone that's sexually active.
Unprotected sex. If you have an unprotected sex with someone and you're not sure of your STI statuses, you should go ahead and get tested for syphilis. Not even syphilis, for everything. Yeah. Okay, so we just add that to the test.
Yes.
Okay.
And so basically, who should get tested? Pregnant women, of course, because we told you they can spread it to the kid and it's dangerous for the baby. Yes. A lot of STDs are dangerous for the baby, so I'm just going to throw this in there, even though we're not.
Just say it, B.
Don't go without prenatal treatment. A lot of people I have discovered will get pregnant and go without prenatal.
For real?
Yes.
Oh, I didn't know that.
Yes. And so you need to see your OBGYN, even in the first trimester, all the way through the third trimester.
I just thought everybody go get their prenatal treatment.
I had a girl come in. She was like, I'm pregnant. And I was like, have you seen OB-GYN? And she was like, no, I usually don't do that until it's close to time to deliver. And I was like,
I didn't know that.
I was just blown away. I was like, what do you mean? I said, are you taking prenatal vitamins?
What she said?
No, they make me sick. And I was like, baby, will you please save your baby and go see the OB-GYN. But anyways, sexually active men who have sex with men are at increased risk. Anyone living with HIV and are sexually active should get tested. And anyone taking PrEP for HIV prevention, they should get tested.
Okay.
And then, like we said, everybody who's sexually active should get tested.
Yeah. So at least once a year, like I tell my patients, like get your STI checked.
And if you're risky, you can get tested more than once.
I got people that come back probably every month.
Oh my God.
Just to get tested, just to see. So
I can relate because I'm like, you back again?
Yes, I know.
No judgment, but
I know, no judgment.
Wear a condom.
Take care of you and educate you. That's all. That's all we're gonna do. So syphilis is called the Great Pretender.
Why?
So it says it's because the symptoms look like many other diseases, so you don't know what it is. It could be something else. It could be a neurological problem. It could be a cold. Like you don't really know what it is. But the thing about syphilis is it's different stages. So you have several different stages, and as the stages go on, it progresses, and it can become a deadly disease.
Yes.
So we're gonna talk about the stages. All right. You want me to start off the stages, or you gonna start off the stages, B?
You can start.
All right. So the first stage is primary stage. Primary first, like primary school first. Yeah. All right. So what happens in this stage? You have a canker or chancre, a chancre that appears in this stage. But you may have other symptoms, other sores also. You may just not have that one chancre. You may have a sores other parts of your body also. Okay. It's usually round, firm, and it may be painless. So when something is painless, people really may not, pay attention, or it may just be a little bump or something may have bit me or something like that. They may not really think of anything. Okay, it appears in locations anywhere over the body, so it doesn't just have to be in your vaginal area. It can be in different places different places. Like I said, it's painless. What else? It may
you may not notice. You may not notice it because it may be like inside the vagina or inside the anus
or something like that.
And since it doesn't hurt,
you don't know. You're right. So it can last from 3 to 6 weeks, and it heals. It may heal.
Even if you don't get treatment.
Yeah, it may heal. But the thing is, even though it may heal, it still can be spread.
Right.
Yes. So that's the importance of making sure you get tested, because it may heal, but you still can spread the syphilis.
And then and even if that sore heals, it can spread in your body.
Yes. And so if you don't get it treated, then you go to what they call secondary syphilis. So what is secondary syphilis?
So secondary syphilis
what are some of the symptoms?
Skin rashes, lesions like in your mouth, vagina, anus. Those mark the second stages of symptoms of syphilis.
Yes.
Oh my God, so many S's. This stage typically starts with the development of a rash on one or more areas of the body. The rashes.
That's when you get the rash on your hands?
I think that's late stages.
Okay, all right.
Yeah, which is we'll talk about that. With secondary syphilis can appear when the primary chancre is healing or several weeks after. The chancre is healed. The rash usually does not cause any itch. And the characteristics of the rash may appear like red, rough, or reddish brown. Oh yeah, it is. So in secondary, it's the spots on the hands and the feet. I thought that was later.
No, it's secondary.
Okay, but yeah, it just looks like I don't know.
I never seen a syphilis rash.
You haven't? It just looks like very dark spots, like on your palms and on the soles of your feet.
Okay. Yeah. I have not seen a syphilis.
It's interesting.
All right, so then you have the so more things about secondary syphilis. Let's see. The symptoms of secondary syphilis may go away without treatment. So it may go away again without treatment. However, without treatment, the infection can progress to tertiary stage of the disease. So we're going on and on and on. So we went to primary, secondary, not tertiary.
And then in secondary, some additional symptoms may be like fever, swollen lymph nodes, glands, like a cold.
A flu.
Yeah, and so you may like just chop it up to it being like a cold or flu.
Even with the rash, I can see that you may think it's a dermatitis or something like that. Not the rash on the palms on the hands or the feet, but a rash on the body, you may think it's a dermatitis. So you may not really say, oh, let me get tested for syphilis.
Right, yeah.
Okay. So I can see why it's the great pretender.
Yeah.
Let's see. So let's talk about the latent stage. Latent stage is the hidden stage. It's the stage where you may not have no symptoms, okay? No visible symptoms at all. Okay, so without treatment, the infected person in the latent stage, the syphilis is in their body, even though there's no signs of symptoms.
Yes.
Early latent stage is when the infection occurred within the past 12 months. So within 12 months, you can be in that latent stage. Let's see, latent stage of syphilis where infection occurred more than 12 months ago. Okay, so that's early latent stage and that's late latent stage. So early latent stage is before the 12 months. Late latent stage is after the 12 months and on.
Okay.
All right, that's confusing.
It is.
But just remember, there's different stages.
Yeah.
Primary, secondary, tertiary. Now we're talking about latent stage. So.
Now, is that right?
Well, what was primary, secondary, latent, Tertiary.
Yeah, now we're about to talk about tertiary.
Okay.
So, yeah, and just basically just remember that the symptoms progress. So you start with one little sore.
Yes.
Then you have all the other symptoms we talked about, like the flu, the rash on the palms, the flu-like symptoms, weight loss, muscle aches,
lymph nodes
swelling, and then the next stage you may not have any symptoms.
So you may have think, oh, I gotten better.
Yeah,
I'm not having symptoms. Oh, it was just a cold. Something that went away. I had the cold for a couple of months, for 6 months, but it went away.
Yeah, finally,
for real, it went away. So so that's a good one. Right.
So tertiary syphilis is rare and develops in a subset of untreated syphilis infections.
Yeah.
So it can appear 10 to 30 years after infection. But I mean, this is when it gets serious, because this can be fatal.
Yes.
It can be fatal. It can affect like the brain, the nerves, eyes, heart, blood vessels, liver, bones, joints. And the symptoms will vary, because now you're getting symptoms again, and they'll vary depending on what organ is affected.
And it's crazy, because then you'll start thinking, okay, what's going on with the eyes? Ophthalmology, let me see if it's blurred vision. Maybe if you have another comorbidity like diabetes, hypertension, you may think the vision is from, the problem is from that. So that's why the great pretender.
Yes.
Okay. We're getting there. So then they have the neurosyphilis or ocular syphilis, okay? So that's when syphilis invades the nervous system. And it can invade your visual system and your auditory system.
Yeah.
So we don't want this. And the treatment is so easy. We're going to talk about that. Yeah. We don't want it in our ears. We don't want to go deaf.
Nope.
We don't want to go
blind.
Yeah.
And when you start to affect the nervous system, that's like your brain and spinal cord, and leads to all kinds of stuff.
So Randy, after all these different stages, how do I get diagnosed?
So go see your PCP.
Okay.
And if you don't have one, you can see us. But yeah, so blood work is done in blood work.
So it's that simple, just blood work. Wow. Okay. And how do I treat it? Because it's the symptoms that you're describing to me look like you may need a lot of stuff to treat this. Like it's gonna take a lot of medicine to treat all these different issues.
Yeah. Well, no. So it's treated with penicillin.
Okay.
So and it just
by mouth?
No, it's injection.
Okay.
But what's the penicillin called?
I call it benzo. How you pronounce it? Benzathine penicillin.
Benzathine penicillin. So depending on what stage you're in, that determines how much penicillin you get.
Okay. So how do we prevent it? Because we about prevention.
We are.
We gonna treat, but we about prevention, right?
Yes.
We want to stop it before it happens.
Absolutely.
So tell us how we can prevent it.
Condoms, abstinence. Abstinence meaning abstaining, not having sex.
Okay.
Not
having what type of sex?
Oral, anal, vaginal.
Okay, so any type of sex.
Yes.
Okay.
And if you do have syphilis and you've had unprotected sex, then it is so important to notify your partner.
Why we want to notify them?
So that they can get tested and treated.
I'm just asking. I just want to make sure. So we went over a lot about syphilis, but the prevention is really easy. I mean, basically, it's preventable.
Yeah.
And the treatment it's treatable.
Yeah.
So if you have it,
it's a series of injections. So you just have to make sure you complete.
Yes. But the thing is, it's treatable. So if you do get it, and you do have any of these symptoms, just ask, can you just test me for syphilis? Because I've been having unprotected sex. I just want to make sure.
Yeah.
It may be something else, but just to be on the safe side.
Yeah, and then just go routinely to get tested for all STDs, because you don't want to be walking around with an STD, spreading it. There's when there's treatment for some and prevention for all.
Yep. All right, so that was good.
Yeah.
All right.
Disclosure.
All right, so as I say every week, this information is just educational information. It's not to replace your primary care provider, okay? We still want you to go to your primary care provider at least once a year, but more if you need to. Just share this information with your family and friends, and let's just have a discussion.
And yes, that's pretty much it. Sums up syphilis, but now that we're live, you can schedule an appointment with us on our website. You can book appointments with us.
Virtual appointments. Texas only.
Yes.
Okay.
For now,
yeah.
B's gonna expand to Louisiana. to the roots.
I'm gonna let y'all know when, so don't be going and book appointments yet.
And rushing her. Come on, when you see me. But yeah, our website is thecommunitynps.org.
Yes.
Also, you can still follow us on Facebook, Instagram, subscribe to our YouTube channels, get all the patient education you need, want. Let us know topics you want us to discuss. And that's it for now.
Why we do this?
Because community is our beauty.